The COVID-19 situation enters a new phase in the Philippines.
Proclamation number 922, declaring a state of public health emergency throughout the Philippines.
A nationwide alert level is up. Code Red.
The DOH is currently exhausting all its efforts to ensure that this localized transmission does not progress to community spread.
In other parts of the world, more and more countries are closing their borders, enforcing lockdowns, travel bans, and other additional restrictions.
We will apply more rigorous and restrictive rules to these areas of the country.
Individuals who are at greater risk of catching the disease are advised to avoid traveling abroad, especially to places with a high number of infections.
DOH urges all individuals who will be contacted by surveillance teams to fully cooperate in the investigation and contact tracing activities.
There are still a lot of unknowns and many questions remain. This is a CNN Philippines special presentation.
Just the facts today amid the misinformation, fake cures, and false medical advice of the novel coronavirus. I'm Pia Ontiveros.
And I'm Dr. Freddy Gomez. We're setting the record straight to understand what's known and what's unknown about COVID-19.
Today we'll be joined by our correspondents who are covering the story from all angles.
And we also have experts and key voices who help us break down this still mysterious disease.
Here in the country, the number of infected people now stands at 49. 3 of them are in critical condition. It was just a few days ago when we confirmed the first local transmission, and since then, the numbers have been increasing. Joining us live in this for this special presentation, our Carolyn Bonkin. Carolyn, tell us first, what steps are government officials taking to further protect the Filipino people?
Well, Pia, what we do know is since January, the government has implemented several measures to contain the virus, and that includes a travel ban as well as putting additional thermal scanners in our major ports. There are also teams involved in contact tracing. They're checking everyone who has been in contact with people who has the coronavirus. Aside from that, various private institutions as well as government agencies have canceled major events to avoid mass gatherings, and that includes the nationwide mall sale. Classes have been suspended. Work from home is now recommended. The health officials are also in talks with public utility vehicle operators so they can come up with guidelines on how they can practice social distancing in our mass transportation, because we do know that these are very crowded, these vehicles, like our trains, buses, and jeepneys. The health officials are also preparing for a possible surge in the number of patients. So the health department already asked our public hospitals to reserve the private rooms and convert this into isolation rooms. Take a listen.
Isa ho sa mga rekomendasyon na ginawa natin ngayon ay mabago po yung ating policy on how we admit patients, on sino po ba yung dapat umuwi, sino po ba yung dapat i-test, sino po yung dapat na i-admit natin sa ospital. And I do not like to preempt because it is still not final. Pero yan po yung napag-usapan kanina, and hopefully bukas po pwede na po natin ipa-approve sa Secretary of Health natin so that we can immediately implement.
Well, Pia, also since January, we've been hearing every day we've been hearing government officials reminding us to wash our hands properly, at least 20 seconds, use soap to cover your mouth and nose when coughing, and also to practice social distancing, which is 1 arm's length from another person. Pia.
Carolyn, there's a lot of speculation, and I emphasize the word speculation, on the possibility of a lockdown. It's a very extreme measure. What is the word on that?
Well, Pia, Secretary Duque says that is still a possibility, but it will only happen when there is already an evidence of a sustained community local transmission. And that means that some of these local cases are not linked together, but health officials, at what was mentioned in the press briefing earlier, health officials will still have to check the data that they have to see a possible link between all of the current COVID-19 cases. But in case that happens, Secretary Duque clarified that this will not be a total lockdown of Metro Manila, for instance, but instead this will just be localized, or for example, only a certain portion of a city like barangay will be on lockdown. Pia.
And of course, to be very clear about this, Caroline, that means, of course, if we are not successful at this stage to control the scenario at this point, right?
Sorry, can you repeat the question, Pia?
That's going to happen. A lockdown, whether it's for a barangay or a city, is going to happen only if we cannot control the situation at the present level, correct?
Yes, Pia, that's right. That was what our health officials are saying.
Right, and just one last question. Testing kits, there are those reports about State University developing a test kit. Do we have enough? And, you know, a lot of people have been saying, now that we're going to have more testing, that means we should be expecting more cases because we're going to discover more of them. What is the word in that?
Well, that's a possibility, Pia, but again, this additional test kits doesn't mean that they will test everybody. Now, let's go back to the numbers. The RITM, which is our National Reference Laboratory, can do 300 tests in a day, while the recently approved locally developed test kits can we can do 1,000 tests in a week from that. And and the FDA Director under Secretary Domingo was explaining earlier that there will still be a selection. They still have to determine whether a patient is qualified for testing or not, Pia.
So that means, of course, a judicious use of these testing kits. Caroline Bonquinter reporting live. Doc, ready?
Yes, Pia. And as we mentioned earlier, we want just the facts, Pia. And let's welcome our guest for today, because I'm pretty sure a lot of our viewers have a lot of questions, and our guests will definitely have those answers. So from the World Health Organization, we have Country Representative Dr. Rabindra Abeyasinghe.
Or Dr. Rabi.
Dr. Rabi, yes. And also with us is Dr. Joshua San Pedro, who is with the Coalition for People's Right to Health. Welcome, Doctor.
From the Interior Department, we have spokesperson Jonathan Malaya. Sir, thank you for being here. And joining us also from the Transportation Department, you know, we talk a lot about the social distancing. Very important to talk about this. Undersecretary Rainier Yebra. We also, hello, sir. Thank you for being here. We also have Alliance of Health Workers National President Robert Mendoza. Mr. Mendoza, thank you for being here. And later in the show, we will be joined on the phone by Dr. Edsel Salvana, an infectious disease specialist at the UP-PGH. Thank you, sirs, for joining us all. The goal today, of course, is to understand the facts, just the facts, because the more we know, and this is very important, the more we can prevent the spread of COVID-19. So let's begin with the representatives of our government. And I'd like to begin with this. Now, are we where we should be? Did we already do what we should have done before? And did we take all these measures at just the right time? Who can take this question? Dr. Rabi. I was going to say government. Yeah, I know, but I think you can.
Yeah, I mean, the DOH has been working extremely efficiently trying to address this challenge that has been evolving at an incredible speed, not here only in the Philippines, but also globally, as we've seen. There's still a considerable way to go, as you see, as countries are being affected, not only in the Philippines, even in countries like Italy and the US. When it actually happens, there's still a long way to increase your preparedness and response capacities.
But Dr. Rabi, did we take the measures we needed to take at just the right time?
You have been. I mean,
it looks like it.
A few weeks ago, we acknowledged your efforts when you had nearly 14 days free of new cases after your initial 3 cases. Our Director General actually complimented the Philippines for its efforts in preventing the spread and containing it.
Right.
But the breakthrough was expected and it did happen.
Now, Doctor, how are people getting tested? Because as a reporter mentioned earlier that there are new test kits coming in as well, cheaper test kits, but there seems to be a criteria for that. Could you explain to us what kind of criteria exactly so the people will know who should get the test?
So let me explain. The testing for COVID-19 are still molecular tests, PCR or polymerase chain reaction based tests, which means you need molecular laboratory facilities to do it. There's some misconception among people because you talk of rapid tests. That's not rapid tests in the conventional language that we use where you have a point of care test. This is a rapid PCR assay that can be done in about an hour's time, right? So, but that doesn't alleviate the need that you still need the laboratory, you need the technicians who have the knowledge to operate those complicated equipments. And that's the challenge that we are facing now, because it's not only the Philippines that needs the tests. There's 107 countries, if I remember, who are asking for it.
So we can have the, Dr. Abinadis, we can have the testing kits here, but the result, the examination will not happen here in the country, but abroad, right? Still here.
Yeah, we have now capacitated the Research Institute for Tropical Medicine to conduct its tests. The first 3 patients, you had to send your test samples out to Australia because you didn't have the capacity.
Okay.
But we worked with the RIT. We've provided them the reagents. NIID from Japan has supported them, and now they have the capacity, and we validated that capacity.
All right.
We are now supporting RITM to validate other facilities, other subnational laboratories, including the UP Manila NIH to do molecular assays according to protocol.
Right, but we cannot test everyone. In other words, there has to be a very judicious use of these testing kits.
Exactly.
It's not like we can test 100 million plus Filipinos. No, that's not going to happen, right?
Yeah, and the Philippines, like many other countries, have developed algorithms to first evaluate the patients and decide, do you need to do a test? And once that evaluation is completed, samples are collected and sent to our ITM for testing. And hopefully in the future to UP.
So in other words, no one can walk in and say, I suspect I have COVID-19, can you test me? And you can't demand that. It is the doctor who
You
will
can
decide
demand it, but the doctor has to take you through a clinical algorithm, evaluate that, and then subject you to testing if required.
I think, Pia, you bring out a good point where a lot of people, because of their fear, they just want to get tested and know for a fact. But there is actually a time and certain conditions in which you should get tested. Could you explain to us, doctor?
With regards to testing, I think one thing that most people have to remember is that since according to our government, we have a limited number of test kits.
Right.
But however, as much as we want to be able to provide the services for everyone, the guidelines usually just state that initially we started looking only at people with history of travel or history of exposure. But lately we've been considering, especially after the 5th case, that we actually saw that there were actual individuals who did not have the exposure, did not have the travel. So some doctors decided to take it on their own hands based on the WHO guidelines.
As long as they exhibited
because they had the severe acute respiratory illnesses. So they were given the opportunity to test these people for additional testing. So that's something that we have to look at in the long run, which select groups of population do we do the testing, as well as looking at the possibility of possibly just doing sentinel surveillance to properly test the population to really find out if we really have just local transmission or the community transmission.
Brief clarification, you said sentinel. Sentinel, what is that?
Sentinel surveillance.
What is that? Yes. In one sentence, sentinel surveillance.
Basically, it's testing certain individuals we want to go outside where we initially suspect. I think Dr. Ravi can explain it better. Yes.
So we have in the Philippines sentinel surveillance for influenza-like illness and for severe acute respiratory illnesses. So what we are now recommending for the DOH, and the DOH has to still implement it, is that in areas that we believe there could be transmission, to take those samples and analyze a subset of the samples that they collect for ILI and SARI for the presence of COVID.
Okay, so more than 80% of confirmed cases of COVID-19 are actually mild. And it also means that these people fully recover from the disease, while 15% are severely ill. And in some cases, they will suffer from pneumonia, but only about 4 to 5% are critically ill from the virus.
And let's get back to that discussion. The message, the underlying message here, and correct us if we're wrong, is that most people do recover from this, and only those who are previously ill or have what you call the underlying illnesses.
The existing.
Those are the existing illnesses. Those are the ones who are really at risk.
Yeah.
In other words, this is not something that is going to be fatal outright, and will scare us, right?
Yes.
Most of the time, yes.
Most of the time.
It doesn't mean that it's, largely the people who die are people who have pre-existing conditions. But we've seen a few isolated deaths also in the younger age groups with people with no pre-existing conditions.
Okay, because it can be very, alarming, when you say, for example, today, the cases now have jumped to 49 in the Philippines. And then when we report the number of cases, but we don't highlight that there are more people who are getting well or who are cured eventually.
Yeah. This is the kind of discussion that we are having, that we've started, many countries are now reporting how many people are getting well, but we are also recommending that the Philippines also start reporting on how many people tested negative, because that's also important.
Okay. So aside from that, there's so much fear that the people are having, and this is sometimes driving people to do things that are counterproductive, so to speak. So what could be, based on the figures for this month, we have COVID-19, which has killed around 3.4% of people, and the WHO has these figures. So with 3.4%, comparing that to, let's say, influenza or the common flu, is this a significant figure? Is this something that people should be concerned about?
Well, what we usually do is compare it with other coronavirus diseases. So MERS had a fatality rate of about 34%, and SARS about 9.5%. So comparing with the other coronavirus diseases, this one seems relatively mild. If you actually break down the mortality is actually higher in those above 60 years of age. If you look at the group under 60, the mortality is less than 1%.
I remember when we were covering SARS and MERS-CoV.
Right.
I don't remember that. There were all these reminders about how to prevent it.
Right.
And the feeling of optimism that it gave a lot of people, because now we have that. We have doctors and WHO, the DOH, telling us that there are things that we can do to prevent getting infected by this coronavirus.
I think that's a key factor, Pia. It's prevention. We always hear that prevention is definitely much better than a cure.
Yeah, well, that's something we learned back in kindergarten. That's something we learned from our parents and from our pediatricians, from doctors when we were babies and little kids. But you're watching the CNN Philippines special presentation.
Just the facts on COVID-19, and when we return, what to do and what not to do in the age of COVID-19. Yes.
Go ahead. A live report from Italy, as the 8th largest economy in the world is in a nationwide lockdown. Stay with us. Be right back. You're watching a CNN Philippines special presentation, Just the Facts.
Welcome back to the program.
The fast-moving infection is spreading more rapidly outside China now, affecting 114 countries.
That's right, Pia. And the World Health Organization says globally, more than 4,000 people have already died from the coronavirus. But we want to emphasize more than 80% of people who get sick are able to recover. So, Italy has the most number of cases outside China, with more than 10,000 infected people. And the government has also reported around 631 deaths. Meanwhile, the Italian government imposed a nationwide restriction on travel and public life. All public events are canceled. Schools, gyms, and movie theaters are already closed. And there are limited hours of operation for restaurants and shops. We will have a live report later.
In Asia, South Korea has the second most number of cases next to China. More than 7,750 people there have the coronavirus. The country was hopeful that things had slowed down over the last few days, but today there were 200 more infections reported. Now, over in the Middle East, Iranian officials are pointing fingers at the United States as the country struggles to contain the coronavirus. The foreign ministry blames U.S. sanctions on Iran for affecting the import of drugs and medicines in the country. Iran has over 8,000 cases and nearly 300 deaths, one of the worst hit countries outside mainland China.
And these are not normal circumstances, Pia. Travelers are on the edge, understandably. And there's only so much traveling we can avoid. How can we take care of ourselves and others?
As the coronavirus spreads, so do bogus information, fake cures, and misinformation.
And there is so much inaccurate information everywhere that the World Health Organization is calling it an infodemic.
So we're going to try and counter the infodemic. We still have, of course, our guests here today, and anybody can just jump in. And this is what we've been talking about the last few days and few weeks, is that all these reminders that we get from the WHO, from the DOH, from our doctors are things that we learned way back in kindergarten when we were small. Things that doctors always told us na hindi natin pinapansin. Ano, Doc Freddy, di ba?
That's right.
The very basic, the very simple things. Like, for example, wash your hands regularly and well and long. I know this sounds funny, and as a mom, sometimes I'm accused of being a nag, pero it works, di ba? Why is it so important? Let's have the doctors step in and tell us, again, remind us, why is washing of the hands so important?
So washing of the hands is really important since the virus can really possibly be killed because of regular hand washing. The mere fact that your virus can easily be killed, we are actually lucky with the fact that the coronavirus is specifically it can easily be killed by hand washing. So it's really something that should be second nature for most people with regards to hygiene. So doing the hand washing specifically for coronavirus, it should be really something that we should be absorbing from day-to-day life.
But it's not always second nature, no? And I'm sure you get that a lot from your patients. Parang, when you tell them, wash your hands regularly, parang they give you this strange look, parang there's something wrong with my doctor, di ba? And yet, this is something we all know that we should do. And some people have said that this is, in a way, this is the silver lining here. And we're reminded about the most basic things that can help in the prevention, correct, Doc?
But I think, Pia, the thing is that most people have this sort of panic because of, even if you say that 80% of people will have mild illnesses, because this is a new disease that the information is really scant, and some people really are starting to gossip and starting to have wild ideas regarding the illness. Maybe it's also because of the fact that our system with regards to health is not really something that it's something we take for granted. It's also because it's not something that is regular in our daily lives. Unlike, for example, in other countries where health services are really abundant, where going to the doctor is a really simple matter, of really as if it's going to the bank, or it's that accessible for every individual. For the Philippines, there are a lot of areas that are still unable to see a doctor regularly, and this is maybe something that's affecting our behavior.
Yes, well, I understand that, but the recommendations of the WHO and the DOH, like, again, washing your hands, drinking plenty of water, staying hydrated, these are things that you can do without having to go to the doctor. And they are preventive measures, right? Is that the philosophy behind it, Dr. Rabi?
Well, the issue is that we have, with the experience of China, seen that these simple preventive measures are effective in interrupting the transmission. We also need to recognize that we don't have specific treatments or vaccine for this disease. So we need to emphasize the importance of preventative measures, the social distancing, the washing of hands, particularly because we know that this is a droplet infection. This is transmitted by contact, by droplets, by people touching droplets and getting infected and then touching their mouth or eyes or nose and transferring the virus into themselves. This is why we're emphasizing that you need to practice social distancing. You need to practice cough etiquette. You need to wash hands because by simply keeping your hands clean, you are limiting the possibility of the virus being transferred to other people, and the spreading of the disease is controlled.
Yes, I think Dr. Ravi makes a good point, and we'll repeat that as the show goes along, that prevention is key. But I think one thing we have to point out is the misinformation, the amount of, or the abundance of what Dr. San Pedro mentioned earlier is brought about by the fear of the people. So with social media being so easily attainable, where can people actually go for the right information? Aside, of course, from CNN Philippines, what do you think is a good solution? Where should they go to? Because this is what drives a lot of the misinformation.
I think that people should get their information only from the Department of Health. Even for us in the DILG, what we do is we just restate or share the information from the Department of Health. No, but when it comes to issues that concern our department, that's when we make our own infographics. For example, today, we made clear to the public that there's no plan for a lockdown at this time. And I've been getting texts from people, I've been taking messages on social media, if indeed they should stop traveling outside of the Manila because they won't be able to come back because presumably government is going to impose a lockdown.
And how do you respond to that?
And by a simple infographic that no lockdown, no to fake news, and this was shared like 10,000 times this afternoon alone.
Yeah, is it too simplistic to say that, you know, a lockdown is going to happen if things get worse, and things will get worse if we don't do what we are told to do at this point, which is wash your hands, social distancing, etc. Right?
Again, let me emphasize that social distancing will only be effective if we do the basic social hygiene.
Right.
It can't be social distancing alone. It has to be both. And it was explained
everything.
to us.
Do everything.
It was explained to us. And Dr. Rabi was there in Malacanang last Monday. It was explained when this was deliberated very lengthily by the cabinet and by the members of the task force on emerging infectious diseases. Why we had to undergo this, no? It's not simply the cancellation of classes. It's not simply alternative work arrangements or social distancing. This entire menu of options. It's also the very basic washing of hands.
All right.
So, yes.
Okay, I'm sorry, Yusek Malab, but we need to do this first. You know, speaking of lockdowns, we talked about lockdowns. Italy is on lockdown with nationwide restrictions on travel and public life. More than 10,000 people infected with COVID-19 in that country. CNN senior international correspondent Ben Wiedemann joins us live from Bologna in Italy with the very latest. Ben?
Yes, Pia. Well, Italy is now struggling to try to impose this so-called lockdown that has been announced the other day. Of course, this is a country of 16 million people. It is a vibrant democracy, and therefore, for many Italians, it's going to take some time getting used to this harsh new reality. Now, we're in Bologna. This is the main piazza or square, and I'll just step out of the way for you. There aren't a lot of people out and about, but nonetheless, stores are still open. There aren't hardly any tourists left in this city. But, for instance, bars and restaurants are closed from 6 p.m. to 6 a.m. And there are suggestions from some Italian politicians that perhaps even more extreme measures have to be taken. For instance, all stores close except pharmacies and supermarkets to provide the most basic needs to the population. We were speaking to one store owner nearby who said, look, we're going to have to take the same sort of measures as China did because it appears that those measures worked perhaps more than the somewhat more relaxed measures that the Italian government has taken until now. Pia?
Ben, the Philippines is not yet at the point where the country you are in is at, but there is already a lot of talk, and you know that's something Filipinos like to do. We like to talk and speculate about the possibility of a lockdown, just as you described it, and this is going to be something a bit of alarming to Filipinos if there will be a lockdown here, or in parts of the country, or in villages, for example. How do the locals feel about this? You know, are they? You did say, you know, that is a vibrant democracy, 16 million people. How do they feel about this? They're adjusting to it. They're following the rules or following authorities when they say that there's going to be a lockdown?
People are adjusting to it because I think when you see the way the numbers increase every day, that there is a realization that there's a reason why extreme measures need to be taken. I mean, just to give you an idea, we arrived in Italy about 16 days ago. The day we arrived, the number of recorded cases was 322 with a death toll of 10. As of today, the recorded cases have topped 10,000 and more than 600 dead. And that sort of rapid, dramatic growth in numbers is sobering. And we're seeing more and more people are wearing masks. You don't see people shaking hands or embracing or kissing on the cheek as was the case before. Slowly, it is becoming apparent to most Italians that this is a profound emergency, not just a health emergency, but of course an economic emergency as well. I mean, for instance, as I was saying, this is normally packed with tourists, this area, and there really are none. In fact, yesterday, we were in this area for many hours. We met 2 tourists from Brazil. And therefore, you know, in terms of just the medical side of it, the economic side of it, reality is beginning to dawn on people that this is a crisis, the worst that this country has seen since the end of the Second World War in 1945.
And for this, Ben, for this, the worst crisis that that country has ever seen, the impact on businesses. I mean, like you said, 2 tourists in a piazza that is usually full. Stores closing, the possibility of so many stores closing. Do we have any numbers on that? What is that going to mean for this country?
Well, in terms of numbers, we're really so fresh into this crisis, it's hard to say. But for instance, the Italian government today is discussing a 25 billion euro relief package. They've already said that there will be a moratorium on the payment of mortgages. They are looking to pour billions of euro into buying more medical equipment, hiring more medical personnel, in addition to providing relief for companies and individuals who now are either unable to make any money or are out of a job. And I think I've just lost my connection with you, Pia. If you will wait, I can redial and hopefully get back to you. But in the meantime, yes, there's a lot of concern among the population. And keep in mind that Italy has one of the most elderly populations in Europe. Now I'm back and connected with you. And according to the statistics that have been put out by the government here, the average age of those who have died is 81 years old. Now, one of the concerns is that given that Italy has very traditionally close family relationships, that elder relatives are not just sort of put in homes and forgotten. It's normal for the grandchildren, the great-grandchildren to visit their grandparents. The worry is that these visits from the children to the grandparents is going to spread the disease further among the most vulnerable elderly parts of the population.
Well,
you can ask me another question, Pia, because I'm connected with you.
All right. Well, that is one of the sad implications of this coronavirus disease all around the world, that family relationships are going to be affected. But Ben Wiedemann there reporting from, and it's so striking, you know, Ben was saying that he's reporting from a piazza that is usually full of tourists, and today they met 2 from Brazil, just 2. That was Ben Wiedemann from Bologna in Italy, where he says, you know, it's a really huge crisis. Well, speaking of crisis, this is a real health crisis we are facing. When we return, some helpful advice, helpful and realistic.
Yes. So
with social distancing of the MRT. With the increasing number of infections worldwide, our everyday routine has changed so much, or perhaps is expected to change dramatically, for that matter, if things get worse.
That's right.
Events have been canceled or delayed. Trips, vacations, many of them are on hold.
And wherever you go, you'll feel the people around you are anxious, paranoid about the coronavirus. So the question is, how do we cope with all of this?
For that question, we go back to our guests. But before we go further, I wanted to ask about this social distancing, keeping your distance in a crowded MRT or LRT. And that's why we have the Transportation Department representative here with us. Sir, although, apart from disinfecting, cleaning, and you've put out a lot of the video to reassure commuters, what can we do? How do we look at this situation?
Well, right now we've intensified our efforts since January, Pia. We've been not only disinfecting for example, the train stations, the MRT, the seats, the rail bars, the handles, everything. We've also handed out sanitizers, soaps in the bathrooms, and we encourage people to wear masks. And not only in MRTs, but in other sectors. So transportation, for example, we've mandated terminal operators to actually give out free masks to passengers. And we've required PUV drivers na magsuot na rin ng maskara, ng surgical, ng mask to protect themselves and the passenger.
Yeah.
Same with ports. We've given masks to our personnel, thermal scanning, and the same goes through with airports. We've intensified the cleaning of the general premises.
Right. Although, and very briefly, I don't want to have a long discussion on this. No, the wearing of the masks, because we've been told that you should only wear a mask if you yourself is sick, or if you are the health worker attending to that COVID-19 patient or to a sick patient, right? But this whole idea about all these measures that you're doing, what's very striking to me is that what you're saying is that there's a lot of personal responsibility here. In other words, there is only so much you can do, in sanitizing, disinfecting the MRT or the LRT, for example. But if people themselves are not going to wash their hands, are not going to cover their mouths or their noses when they sneeze or cough, for example, stay hydrated, very limited na ang capability niyo. Correct? Is that right?
Tama po yan. To combat this virus right now, it requires the collective effort of everyone. Hindi lang po yung government, hindi lang yung private medical sector, but even the citizens themselves. They have to be aware, they have to be conscious. So talagang tulong-tulong.
Yeah, sir, can you jump in here? Let's talk about that, no? Because, people like to say, the DOH is not doing enough, or what are they doing, or what are they doing to combat this illness? They've done enough, right? There are things that we as citizens must do. Yeah. Correct, sir?
Yes. Right now, as far as the health workers are being monitored, as they are right now worried and anxious regarding their themselves, because as for the DOH certain hospitals right now, like for example the Reyes Memorial Medical Center and the San Lazaro hospitals, nagwo-worry ang mga health workers sa ngayon dahil wala nga silang mask. Sa Jose Reyes nga po, the interns, the clerks are hindi na po binibigyan ng mask dahil para lang po yun sa mga regular employees sa operating room. So, sa ngayon, hindi nila nafe-feel na dinagdagan ang budget sa Department of Health para doon sa kaso ng mga COVID. Subalit, talagang wala pa rin, ngayon sa kasalukuyan, wala pa rin supply.
Ano yung problema natin? Bakit walang supply? Naubusan na ba? And this is why people have been reminded that if you're not sick, you don't wear a mask. If you're not a health worker, you don't wear a mask. Because for the longest time, ang daming reports people hoarding masks, people buying too many supplies of masks, hindi ba? Which takes away the supply that is needed for these health workers.
Yes, right.
Correct, sir?
Yeah. Sa ngayon yung worry ng mga health workers, lalo na yung mga nasa operating room, yung mask na napakanipis ay hindi talaga kakayanin doon sa virus na papasok. So, dinodoble pa po nila yan, tapos ginagamit nila within 3 days. Kaya ito yung worry nila na paano kami bilang mga health workers, mga frontliners, ay hindi kami napoprotektahan doon sa issue ng coronavirus. Kasi ang problema din sa atin sa Department of Health, 10 billion ang kinat na budget for 2020 na supposed to be, dapat kung hindi yan kinat, mayroon tayong sanang pondo para doon sa mga PPEs sa mga health workers.
So,
at the same time, ang worry ko, ang Department of Health din, napakalaki ng kinat na 10 billion at hindi lahat ng DOH certain hospitals ay mayroong mga negative pressure room. So ito yung worry ng mga health workers na aside from RITM, San Lazaro, Lung Center of the Philippines, nag-worry sila, East Avenue Medical Center, kasi wala silang mga ganong mga facilities talaga para ready sana doon para sa may mga ganitong mga viruses na mga...
Ang dami yung issues kakulangan ng supply ng mask, yung negative pressure rooms.
Yes.
Yusek Malayo, were you appeared to want to respond to this? No. But Dr. Rabi, please.
Let me clarify. I mean, we need to change the dialogue now because we need to go beyond hand washing and social distancing and cough etiquette. The focus now should be on protecting our health workers.
Yes.
We need to protect our frontline health workers. We know that local cases have been reported.
Yes.
We know that potentially infected people are seeking treatment in outpatient departments. Clinicians are caring for sick people who may be manifesting with severe disease. So we need to ensure that they are protected, that they can go back safely to their loved ones in their homes. So they need to have the kind of protection that will help them to work and provide the services necessary to the population. That is a priority. For the people, we need to take it beyond those three things that I mentioned. They need to start practicing social distancing. Like Ben Wiedemann was saying, you need to, if you're having signs of a respiratory infection, you need to distance yourself from your loved ones, particularly your elderly loved ones, because if they have underlying disease, they are more likely to develop severe disease if by chance this infection that they have is COVID-19. So the dynamic shifts now. We need to do everything to protect our health workers. We need to do everything to protect the most vulnerable. So if you're sick, you should socially distance yourself from not going to school, not going to work, not going to crowded places. But even in your home, you need to socially distance yourself. Separate out your utensils. Try to sleep separately in a separate room so that you're not putting your loved ones at risk.
Okay. When you say, Dr. Rabi, protect our health workers, we're not just talking about masks, right?
No, we are talking of PPEs and masks.
Protective equipment. Okay.
And let's clarify, management of COVID-19 patients don't require negative pressure rooms. Our WHO recommendation does not.
All right.
We need intensive care facilities to manage the critical patients. That's largely ventilators, oxygen. We know that COVID could, in critical cases, lead to renal failure. You need to have facilities to dialysis. That's what is critically important if you want to prevent the deaths, right? Because we know that once COVID-19 patients become critical, the mortality rate now is about 50%.
Okay, deaths and mortality rate. Based on figures this month, COVID-19 has killed 3.4% of people who are sick with it. Compare that to the seasonal flu with a mortality rate of less than 1%. And again, let's go back to our guests. Again, just to emphasize, Dr. Rabi, like you were saying, we're not talking about negative pressure rooms. That's something that is not needed at this moment. But we do need that protective gear
Protective equipment.
and the masks
Yes, of
for
course.
all health workers, all frontline health workers. Yusek Malaya.
Yeah. Pia, let me just emphasize that I don't think we have a problem with funds. This was discussed very lengthily in Malacanang last Monday. And the Department of Health requested for money, and the money is available.
Okay.
The Department of Budget Management Secretary Wendell Avisado himself said that we're just at the beginning of the year. We haven't spent anything yet. And whatever the DOH needs, the government will give it. And even if there was a cut in the DOH budget for this year, we just started the year. So they have enough money also.
Okay.
I think the question of the masks is more of supply.
Supply.
Right.
In the Philippines, there's only one company that produces masks.
What is
It's
that
in
company?
Bataan.
Okay.
I forgot the name of the company.
Okay, and?
that company is already working overtime to produce all the masks. But there will never be able... that
They will
company
never be able to
will never
fill
be
that.
able to fulfill all the requirement because masks are replaced every day.
Right.
And the demand is just so big that we cannot even rely on foreign sources because everybody needs masks all over the world. So I think it would be unfair to say that government is unable to respond to this issue simply because there's no money. There is money, but it's just...
Nauubusan lang ng supply.
Nauubusan lang po ng supply.
I don't know if you've been able to look into it, but what caused this? Was it... We had the Taal eruption on January 12.
Yes.
There was a mad scramble, to say the least, for masks. And people were buying masks off the shelves of all these drugstores.
It's also the psychology of the people, you know. Instead of buying one or two for myself, you'll buy a box. And I've seen people go to Mercury Drug and buy so many boxes. No? For example, the DTI started talking with the supermarkets because a supply of alcohol is also becoming short.
Right.
So the DTI talked to the supermarkets, and then the supermarkets decided that we will limit the sale of alcohol to 2 units per individual. So things like these, will be able to address the needs of the people. I think a bit of discipline. Instead of just thinking about yourself, think of the entire community.
But a lot of discipline. Because correct me if I'm wrong. No, if you control what you buy, then that gives the other person, like maybe your neighbor, the chance to get the alcohol he or she needs. Correct.
That's right.
The mask, the alcohol, anything that you feel like hoarding or panic buying can go to your neighbor.
Yes, and I think at this time in our country's history, I think it's important that people take responsibility. Because, for example, when the DOH and the WHO recommended social distancing, there was a big debate on should children stay in school or should they go home? And should we suspend classes? And there was a fear that if the kids are sent home and not go to school, they will just go to the mall. And the teachers were saying, let's just keep them in school because the parents are not responsible. If they're working, who will take care of the kids? So that's where the Secretary Anyo came in, and Secretary Anyo will order the police, will order the barangay officials that if there are kids loitering around, send them back. So again, it's responsibility because it's true that the police and the barangay officials will do their part, but how about the parents?
Okay.
The first guardian of the kids are the parents. So if someone is going to implement social distancing, the parents should be at the forefront to ensure that the kids, don't loitering around.
Everything starts at home. But we're going to get back to that in just a bit. Many will advise us we need to get on with our normal life. We just need to be more aware, more careful. Malls, we're talking about shopping malls and other business establishments, intensifying efforts to make sure everyone is safe. Our Rex Emilio is at a mall in Ortigas to see what measures they have in place. Rex?
Families and friends are still flocking to the malls despite the threat of the coronavirus. As you can see, shoppers are going to stores, eating at restaurants, or simply strolling around. Most of them are wearing either protective or non-surgical masks. Now, the SM Supermalls management has been placing strict measures to protect the public from the virus. For example, if you're going to SM Mega Mall, this is what you can expect. At the entrance, the guards would use an infrared thermometer to take your temperature. If your temperature is 37.6 degrees Celsius or above, you will not be allowed to enter. Instead, the security will advise you to seek medical help at the nearest hospital. Now, if you're cleared, you will still undergo security checks. As you go further, a few meters behind them, personnel will ask you if they can spray alcohol on your hands. After that, you can finally proceed inside the mall. There you can see what they call sanitation teams going to areas with many customers. Every 30 minutes, they sanitize restrooms, door handles, and escalator handrails using clean agents. They also installed sanitizers in many areas in the mall as well as air disinfectants. Once the mall closes, they say they still do thorough cleaning of the premises. Now, the mall management says that you will still have the same joyful shopping experience once you come here. The difference now, though, is that we're now more mindful on how we can stay safe despite the virus. Back to you.
Rex Emilio there, reporting here, watching just the facts of the novel coronavirus.
Yes, and we'll be back after a short break. When we return, we'll discuss the response we should not take to fight this disease. This is a CNN Philippines special presentation.
Welcome back to a CNN Philippines special presentation.
We bring you just the facts on the novel coronavirus or COVID-19.
There are many reasons to worry, but our fearful reactions, the panic and the anxiety.
That's right, and all these can put other lives at risk. Let's talk about some realistic steps that we need to take because disruptions are definitely bound to happen. So let's get back to our guests with regards to these topics.
Well, we were talking about the masks already, and other supplies, panic buying, hoarding. People shouldn't be doing that, right?
But for me, before anything else, I think one thing that we shouldn't really be doing is sometimes we have this tendency to blame people for their actions, especially when they're really just driven by their anxiety and their fear. And we really have this tendency to blame the victims of the situation. That sometimes we fail to take into account that what this disease, what outbreaks really show, the massive inequality that is existing in our society. That as Dr. Ravi mentioned earlier, it's the vulnerable populations that get hit first. And they are more possibly to die even from the disease. So aside from the elderly populations, we also have, of course, the poor who do not really have an option to go to expensive private hospitals, who prefer to think about how to feed their families rather than to how much they're going to spend in the hospital. So with regards to sometimes they take things for granted in the sense that how can you be able to think about hand washing when you don't have running water? How are you able to think about eating properly when nutritious food is very expensive and junk food is really cheaper? So with regards to social distancing and self-quarantine, sometimes it's a privilege for individuals. Now we fail to take into account that most Filipinos or some Filipinos live in shanty houses that do not have rooms that are eligible for self-quarantine, or that social distancing is really a privilege when you're traveling in a very tight LRT, or when you basically just live less than a meter away from your neighbor when you don't have proper housing. So there are really things that we fail to take into account. But blaming people for their actions, sometimes we really have to look at the larger context, that the inequality is existing, that people with diseases like diabetes and hypertension, why do they have these diseases when they grow older? It's because they're not able to take care of their health because our focus is not really on prevention. And being able to take care of these illnesses earlier on before they develop complications. Hopefully we're able to look at these things as well.
Well, you raise very legitimate points. So what do we do about that?
I think
what can be done?
I think it didn't have to take an epidemic for us to realize that we have to strengthen our primary care system, our primary health care system. People should really be seeking medical attention, not when they have severe illnesses already, but even as part of preventing illnesses, to looking after their nutrition, making the access better on the part of our government, on the part of the Department of Health. If we really focus on primary care and being able to focus towards what people need as they age, with regards to providing proper food security, with regards to properly funding our primary care services, so that it's not an issue of when will I be able to see a doctor, but it's an assurance that we don't have to, like now we have one doctor for every 33,000. If in other countries, I'm sure the WHO has mentioned some countries that have a very low doctor-to-population ratio, like Cuba, for example. That is really something that people would learn to appreciate if health services are really readily available for every individual.
Yes, you second line.
Well, I think as you said, Dr. Joshua raised some very important points. And I think that's the reason why we have the Universal Health Program of the government. It was approved, it's already a law. It's funded already under the GAA for this year. So we're slowly implementing that. So I think that addresses that concern. For the first time in our history, we have that program.
Right.
Now, if we're talking about malnutrition...
And we have more PhilHealth coverage, for example.
Yes, and universal PhilHealth coverage. And also, if we're concerned about children in school, our kids are malnourished or underweight, and therefore, when they grow old, they develop further diseases because we didn't take care of them while they were small. We now have the school feeding program institutionalized under, again, another law, again funded under the 2020 GAA, so which will provide school feeding in schools for more than 60% of the school days in a school year. So all of these programs, I think, addresses some of that. But of course, it won't address all, but we're getting there.
Yes, well, I wish we really had more time, but we were supposed to focus on the coronavirus. Of course, there are so many other factors that affect this, but perhaps in another episode, in another special presentation, we could do that. But we really need to go now. Yes, but the important thing was that we just needed to emphasize what we must do and what we should not be doing, because this is a real crisis we're facing if we don't do the right things at this point, right, Dr. Rabi? So we just want to say thank you very much to our guests. Very quickly, Dr. Rabi Abea Singh of WHO, Dr. Joshua San Pedro, Jonathan Malaya of the DILG, Undersecretary Rainier Yebra of the Transportation Department, and Robert Mendoza of the Alliance of Health Workers. Maraming salamat. Thank you very much for being with us tonight. This was a very thoughtful discussion.
Yes, it definitely was, Pia, and we needed more time, but maybe in social media they'll be able to ask some more questions and we'll be able to answer those. So
we're going to continue on Facebook.
Yes, definitely. So I'm Dr. Freddy Gomez.
And I'm Pia Ontiveros. This has been a CNN Philippines special presentation, Just the Facts.